Okay, welcome back to my kitchen classroom. Joe's here, Courtney and the dogs. I'm sorry I missed last Saturday. I was in the emergency room. Everything went well, and I want to talk about emergencies room with you, but not this session, our next discussion, because it's all fresh in my mind with ideas. But right now, I want to get right to procedures and nursing care. That is the focus of this, the standards of care, and particularly at this time, the administration of medications. If you're in the hospital, you're going to get medications, one way or another probably. And you're going to get the medications either PO, which is by mouth. You might get some, stay with me, just sublingual, which is under your tongue, very quick administration of medications. Subcutaneous, IM, IV. You might have an installation of medications into your bladder. You might have medication into your spine. So there's all sorts of routes of receiving your medication. Did I leave anything out, honey?
Well, an intravenous.
Well, IV, that's the whole, we're doing IV all, a big session on that. But when the student nurse comes and is learning about medications, what is taught is what is called the 5 principles, or the 5 rights, or the 5 things that must be incorporated in your nursing care. And they include, I'll list the 5, and then we'll look at each one of them and how they affect you. The right patient, the right medication, the right dosage, the right time, and the right route. There's 5 things, and each one of them is very important to the careful and safe way that you're receiving medications. So let's take the first one, right patient. There's more done now, I think, to identify patients than there ever was. Now that we got the computers, they come in to you and they say, what's your birthday? Everybody. That's a good check on, because years ago they could say, hello, Mrs. Jones, and the person could say, yes, I'm Mrs. Jones, or whatever. They also have the scanning of your wristband now. So they got the computer backup, but it still comes down to the nurse to depend on her follow-up and making sure it's the right patient. Now, I remember vividly 60 years ago that I gave a medication to the wrong patient. Now, think about that. I did this 60 years ago. I was a new nurse. Do you remember? Did I tell you this, Joe?
No, I didn't.
Maybe I never told you this. But I was a new nurse at the VA hospital, and I drew up medication. And I'm not sure if it was pain and medication, or I think it was a pain medication, and I gave it to the wrong patient. I have to tell you, at that time, I felt terrible. I had violated everything I had learned. So what I did is I went to the head nurse. Because the one thing you're taught as a nurse, if you make a mistake, you let them know right away. And I went to the head nurse, and she was an old Navy nurse. I remember her well. And she looked at both patients' charts, and she looked at the medication. It was a cardiac unit, so she knew everything about what medication. And she said, this medication will not hurt this patient at all. It's used by most of the patients on this unit, and that's okay. And then, but she said, you got to give the correct medication to the right patient, because it's a double error. If you give a medication to the wrong patient, that's a danger. But you have to make sure you follow up and give the medication to the right patient. Now remember, I did this 60 years ago. I never did it again, but it's so vivid in my mind because nurses are trained to identify their patient and be accurate on a patient. And I think this is very, very important at this time. Now the right medication. Okay. You hear of errors. Medications, dosages. We have now, doctors are told to write their prescriptions more legibly. Doctors have a tradition of scrawling things out. Now they're told to spell out things instead of all these that POs, things like that. by mouth or subcutaneous, or just take the time to make sure, and particularly 0.15 or 1.0 or 0.1, they are major differences in medication, major. So they have to, that's the first thing. Now nowadays the pharmacy is more involved. There will be oftentimes unit doses will be set down. The shots are drawn up in the, right Joe? You back me up on this, honey. When I taught it, the nurse drew up the medication. I think they still do too. Or take the pills and count out the number of pills. So if you got the right medication, and again, as you teach the nurse, three things you do. Say you're in the medication room. There's usually a treatment room and a medication room. The nurse goes and she takes the medication, whatever it is, the bottle or the ampule, and she reads the label then. She brings it down, she takes out what, 3 times now. She reads the label again before she takes the pills out or draws up the solution. Does what she has to do, and then reads it again as she puts it back. 3 times you're supposed to read the medication. Now that's what I taught. I would imagine students are still taught that. This is the care you do to make sure it's the right medication and the right dosage. After that, we're talking about...
how does the patient know that she's getting the right medicine?
Okay, these are things that the nurse does in the car. Okay, when you get to the bedside, okay. This is, I think I'll finish this and then I'll talk right at the bedside. Because nurses come around, and they used to come around with a medication card with it. They probably don't do that now.
They still do.
They did when you were in the hospital? Yeah. Come in with a medication card and they take out the medications that they're giving to the patient. Sometimes, years ago again, they used to have one medication nurse that did all the medications for the unit. I don't think they do that anymore because they want the nurse who's caring for the patient giving the medication because they know that patient. And so that this has to do with the right medication. Now okay Joe, we'll go to the bedside. This is where you should be able to ask some questions. Now it was interesting, last year, and I'll get this article out again, there was something in Consumer Report, 50 things you need to know when you're in the hospital. And one of the things they said is don't ask questions of the nurse when you're getting medications. And I thought, oh wait a minute, yeah. Don't ask the nurse, I want to tell you about my trip to Bermuda, or how's your kids doing now, or what's going on, have you heard in the news about what's going on in the investigation. Don't go there. But certainly you have a right to ask the patient, the nurse, I haven't received this medication before. Could you tell me a little bit about it, what it's for? When I was at home, I took these pink pills, and these are blue. What's the difference? Logical questions. Again, the nurse double checks and makes sure they're correct with this. So there's questions you ask during the process that zero in on the process and what is being given. Anything else you'd suggest could say to the nurse at the time? I have a list of questions and I don't want to go over all the questions, but they're legitimate questions that you should ask because it's your body and the medication is going into your body, so you ask the questions. When I taught students, they had to know everything about that medication they were given. And I would ask them at any time, tell me what's the usual dose of that medication, what are the side effects, and they needed to know that. You should never give a medication that you don't know the usual dosage, the maximum dosage. And this is something, and I don't care, they pull it out of their, it's okay, they pull it out, they have a little card, they had to do research on the medication. Now nurses are on a cardiac unit, they know their medications back and forth and up and down. They know the dosage that's too high. But every nurse should be able to give you information. Is this the usual dose of this medication. And if it, let's take another step further on that. This is something I believe in and something I taught. What if the dosage is higher, the doctor ordered, than what you know is the high dose? Well, you talk to the doctor. You say, doctor, it's my understanding that this medication is. Now, he or she may not like that, but, right, Joe?
Never.
But you have a right to do that, because the bottom line is you're giving that injection. So you're legally responsible for that injection. So you say to the doctor, you know, and he said, he or she, well, this patient responds a certain way, and I decided it has to be just a little bit higher because it'll react. You know, they have a rationale. I'm not arguing that. But take, for example, I thought this was so interesting that what happened, I'm on time, that thing that happened in California with fentanyl. Any of you read about that? There was a doctor that gave lethal doses of fentanyl. Shocking. I don't know anything about it, anything at all about it. It was in the paper a couple weeks ago. But I looked at what was in the paper, and there were 22 or 24 staff members who were under investigation also. Now I'm assuming, I don't know, I'm assuming they're the people that gave the shot or gave the medication, because they gave it. Now why there were not red flags, why no one said this is too much, why no one said I will not give that shot, because you as a nurse have a right to say that. I'm sorry, doctor, from what I understand, this is a very dangerous dose, and you might get a lot of heat from the doctor. It doesn't matter. You're the one giving the shot. So what I'm telling you, nurses are taught to understand the medications that they're given and the dosages, and they should be able to share that with you as a patient. And they should raise the red flags, and they should say no, something like that. Right dosage, right time. I think I'll go to right route now, okay? Because I want to give a demonstration. You've all received shots in the hospital, correct? Nowadays, I have an orange here. That's so old-fashioned, my word. Because the students now, they got all these computerized models and everything. But the purpose is here that if I'm giving a shot, first of all, I would come in to the patient and tell them what I'm doing. Some people, they just don't like shots, so I help them to relax. There are ways they say an IM shot. So I would go in, I have my alcohol wipes, I've drawn this up correctly in the medication room. Dosage is right, everything's right. The different ways shots are given, there's given subdermal, which is basically underneath the skin. You go to a allergy doctor and they put just a little bit under your skin so they see it, they can watch it. Subcutaneous, subdermal like this, subcutaneous at that. Do you see it, Courtney? It's a different angle it has to be given. IM, straight down and in. Okay? Subdermal, subcutaneous, IM. We're not talking about IVs now, okay? Seems very straightforward, but where is it given is the important part in how you give it. Now I checked with Julia, my granddaughter. They're not taught to aspirate the medication when they put it in on which but it's okay if you do it. By aspirate is if I put it in, I pull back on the syringe, the plunger, to see if I'm in a blood vessel. Okay? Obviously, research has shown that that's not necessary. If I was giving a shot, I'd still do it, and a lot of nurses will still do it. So it has to do. But where you put it is also as important. You don't want to hit a bone. You don't want to get in a blood vessel. You don't want to hit a nerve. So on the shoulder, they're taught, used to be 3 fingers down from the bony prominence. Okay? Usually subcutaneous in there. All right? depends on your patient. You have an elderly patient, not much muscle there. You got to be very careful about going IM in that area. You got to get a spot where you know you got a good muscle to give an IM injection. If it's in the buttocks, we used to, and I have to ask Kelsey or Julia this. We used to tell the students you make a cross like this. You're not praying over the patient, but you make a cross like that and you go to the inner aspect of the upper outer quadrant. Now, where they're sighting it now is not as important. I'm not teaching you how to give an IM shot. If you're going home and giving a shot to your husband or your wife, the nurse will teach you. What I'm saying is that was done that way so you don't hit a nerve. You don't want to hit the sciatic nerve when you give a shot in the buttocks. So if you got a good area of muscle back there, you get the proper site and you give the injection. Okay, this is what nurses are taught. I want you to know that. So when they come in, and there's a question, how do you figure out where you're going to give me that shot? Oh, just curiosity. My mother is awful thin now. Is it okay if she gets a shot in her shoulder? Simple question, not too much, but focusing on how they were taught. Okay, right dosage, right route, right time, important. Nurses are taught to give the medication, say at 10 o'clock medication, you can give it half an hour before or a half an hour after. Now a busy unit, things happen, it's difficult to be right on time. But if you didn't get your 10 o'clock medications to 12 o'clock or noon time, there's a question there. And if you have one nurse that's assigned, you should get that medication done. With antibiotics, you're going to get them 24 hours a day. You're going to be woke up to get your antibiotics if they're not coming in IV. Because it's a blood level, right, Joe? You got to keep that antibiotic at a certain blood level. So the timing is very, very important. Okay, I talked about, what else did I leave at the bedside? You're absolutely right. I mean, it's interesting to know, and you have all these medical, you see how they draw up medications and give shots and prevent infection. But for you, it's important to know how they're taught to give the shots. So you can ask a question about placement. You certainly can ask a question about dosage, particularly. And any nurse that's giving a new medication has to go to the PDR or the physician's desk and look that medication up. That's the way they're taught. So the question is legitimate. Now let me see if I got some other questions in here. We got time? What are we doing with the 15 minutes on?
Oh, we're good.
I want to spend a whole 15 minutes in IV, and I should have that because that's a part of your medication epic that you really need to know. I did this under, I'm in my military model. I put medications under planned maneuvers because they're planned. They're in your plan for that. And you know what it is. Let me see what I got. There are many medications I take at home as a doctor ordered them for me here in the hospital. That's of concern when you first get in the hospital. That's transition. That's a very legitimate question. I think most people should check that. You have a right to look at your Cardex. Your Cardex should include with a red mark if you're allergic to anything. That's what they used to do. If a medication is not given, it's circled that it wasn't given or crossed off because you have to keep track of the medications.
Well, that's why you bring your list of medications with you to the hospital.
Yeah, we said that before, and it can't be said enough. And when I went to the emergency room this time, I had my medication list with me, and it's very important. But still, even if you bring them with you, maybe they didn't it's a matter of communication, say, from the admitting office to your ward, to, you have to make sure that that chain is in. I have an extra pill today. What is it and why am I getting this? How do you keep track of all my medications? You know, curious how you do it. Anything else? Courtney, questions? You got any questions? I guess this is the time I will turn to my class or my group and ask questions. Anything comes to mind? I'm not putting you on the spot, but
I did have one a
Nothing
while
really.
ago. I think I might have forgot though.
What?
I did have one a while ago, but
Well,
I was
that's
just
one out of your mind,
I was
but-
following
Okay.
along.
Well, take a minute. Jump right in. I think we're all. Are we? You always going to tell me 5 minutes?
Yeah, you've got. If you, we went, I'm gonna cut it in half because we
Don't
went a
forget,
little
we're going to
over.
do IV. IVs are
Yeah.
crucially a part of medication application
Yeah.
now.
I had a friend that had the, she had a shot, just a flu shot, and they did it right in her bursa sac in her shoulder, and she lost like the use of that whole arm for a long time.
Okay.
And that came to mind when you're talking about the placement of the shots, and because I mean I take my daughter to get vaccinations, and
Yeah.
that seems to be something that I should make sure that they're putting that in the right place. I never thought twice to
You're
question
right.
that
That's
before.
exactly. That's and into the bursa. It went
Yeah.
into the bursa.
Yep.
She had damage.
Yeah, she had bursitis for a really long time
That's a
after
very,
that.
very good example. Any examples you
Well,
want?
the other thing is, you know, if they're going to give you some medicine, they should really ask you, have you ever received this before? You're not allergic to this.
For the initial.
Yeah, initially, so that, just to make sure you're not allergic to to
So
penicillin.
certainly a new medication, yes.
Yeah.
And it should be on your card. They should ask, that should be one of the questions you're asked on admission. One medication, what are you allergic to? That's that, but double ask again. Especially with certain medications such as penicillin, that you'd be more apt to be allergic to.
Or medications that interact with other medications.
Yes, right. Well,
Is very
yes.
important, especially if you're on a blood thinner.
Yeah.
And they certainly don't want to give you an aspirin if you're on
Yeah.
blood thinners.
Yeah,
Mhm.
okay.
Also,
Any-
the timing, like
Okay.
I was thinking, so if someone is in there, maybe setting an alarm on their own phone or their own time, however they're keeping times to keep track of the system as well, so that they don't lose track. Because it's easy probably when you're in the hospital and you're not doing your daily routine to just lose track of the time in general,
Yeah.
you know. And so to keep on top of that, maybe use like your cell phone as a tool or something. Set your own alarm so that you can say, hey, it's time for my
Well, it's
medication.
just talking about keeping a record of what, I think, if are we still on camera? Are we still
You've
talking
got
to people?
about 5 more minutes, yeah?
About 5 minutes. So this goes back to the question of keeping track of what's being done in the hospital. A log, a record. I'm receiving these medications now. It's good to know so that in any final, when you're talking to your doctor, these are the medications I'm getting. These are the treatments I'm getting. Remember I talked about this is the RN in charge of the people. You gotta have the people there. You're just caring. Now you're not doing this for any vague thought of malpractice. You don't want to go there. That's not why you're there. It's not, it's not a part of, you want to prevent anything happening. I can't say that enough.
But in the case where you're so sick that you don't have the foggiest idea of what's going on in the hospital, then again, your advocate is with you, and they should ask questions.
Yep, that's exactly right, Joe. That's why it's a team effort. That's why we speak of the family being involved. Because you're right. I was kind of your advocate. I didn't do too good a job when you were in the hospital, in a certain sense, because he had a tick infection, and I did say to the doctor, remember this, the infectious disease doctor, I said I had anaplasmosis a couple years ago. Could he have that? And the doctor said, "Oh, it's not tick season." And I didn't follow up on it.
And guess what I had?
He
Anaplasmosis.
did have it. And they were going into all different
Lynn
ranges.
nailed it.
And I kind of look back at that and I say, why didn't I say, but doctor, could you just check him for it? I mean, you know, I know it isn't tick season, but we were down in New Jersey. I mean, who knows? Could you? And I didn't do that, so I wasn't your best advocate. But advocates need to ask questions, and I guess that example, follow up on questions. You know, just don't be pushed away on, oh well, it isn't this, or no. You need to be treated with respect, and your questions need to be listened to. I'm gonna have a little cup of coffee now. Anything else? I'm so ready to go into emergency rooms, but I don't want to do that till I think through this. How's that?
Well, good.
Okay, we'll stop for now. I am going to go back to my every Saturday at 10 o'clock. But let's stop for a minute, and then I'm going to talk about emergency rooms, because it's all in my head.